Hello all, welcome. In this video we are going to see about cardiac system, Iicsirnet previous year questions from 2020 to 2015. This will be useful for Iicsirnet GATE Life Science people. And you are watching this on Life Science Library. So far we have seen some of the basic things about cardiac system, cardiac cycle, excitation in cardiac muscle, excitation in ventricular muscle. As of now, we are going to see about previous year questions from Iicsirnet portions. First question from November 2020 session 1. Action potential recorded from pacemaker tissue of mammalian heart is shown in the diagram. On the basis of the mechanism of generation of action potential of pacemaker, consider the following options. Funny channel is activated at point B. Outward flow of K plus ions occur at A. Correct. T calcium channel close at C. Fast Na plus K plus channel open at D. Upward phase of D is largely due to inward movement of K plus. So we are supposed to find the correct statement. Funny channel are activated at B. A option is correct. Here the funny channel, that is Na plus channel, is activated. Outward flow of K plus occur at A. T calcium channel close at C. This is a wrong answer. This does not close, it open. Fast Na plus channel open at D. No. So C is not the right answer. D is not the right answer. So A is the right answer. Let's go back and see the graph of pacemaker. This is the graph of pacemaker. Where Na plus channel is opened here. Na plus channel is closed here. T plus channel is open here. And T channel is closed here. Calcium L channel open, and this complete depolarization occurred due to calcium L channel, and it reaches peak at plus 10 plus 15, and it again comes to the base point. This is the overall idea. Funny channel. This Na plus channel is called as funny channel. Because the resting membrane potential for all other is minus 70 MB and resting membrane potential for this is minus 60 MB. So it is called as funny channel. Next question about fibrinogen, that is clotting factor. Fibrinogen is the clotting factor. What is clotting? So consider you have a wound. You have a wound here and the blood flows through it. The blood naturally clots, so the blood flow does not occur outside the body, is restricted. This is called as clotting factor. There are so many clotting factors. Among this one among them is fibrinogen, that is factor 1. It is a soluble glycoprotein present abundantly in plasma. Characteristics of fibrinogen. This is very static portion. It is a dimer of 3 polypeptide chain, A alpha, beta and gamma twice. Homodimer. This is a wrong answer. And the chains are covalently linked by 29 inter and intrachain disulfide bridges. So A and C is the right answer. D and B are the wrong answer. This is static. That doesn't require any much conceptual understanding. Next topic is about RBC from November 2020. So RBC. Synthesis of fatty acid does not occur in RBC. So what is the main RBC lack nucleus. This is a major point. Still, RBC contains adenosine deaminase and pyrimidine nucleotidase. So D is actually correct, but it is given as wrong. This is our answer. RBC cannot synthesis reduce. No, RBC can. All cell have the potential to synthesis glutathione. So this is the wrong answer. We are supposed to mark wrong answers. So C is our option. Pentose phosphate pathway is operative in RBC. This is right. NADH dependent methemoglobin reduction system is present in the RBC. Is correct. Only then hemoglobin is produced in RBC. That's why RBC is red in color. Okay. A and E are right answer. Synthesis of fatty acids does not occur in RBC. No, we have a separate organelle for the synthesis of fatty acids. It does not occur in beta oxidation and fatty acid synthesis does not occur in RBC. This is also right. A correct, B correct and E correct. We are supposed to find the incorrect options. So C and D are the right answers. RBC cannot synthesis reduced glutathione. RBC does not contain the enzyme like adenosine deaminase or pyrimidine nucleotidase. C and D are the right answers. Next question. Loss of large quantity of blood in an individual during hemorrhage provokes many physiological changes which are compensatory and decompensatory. Mark these two words, decompensatory and compensatory. Following statement describe few compensatory or decompensatory mechanism operating in this condition. Peripheral chemoreceptors are stimulated when arterial blood pressure is reduced below. With described few compensatory, we are asked to find only decompensatory mechanisms. Okay, the mechanism by which they are not compensated. See the third option, mononuclear phagocytic system become depressed during the course of hemorrhagic hypertension because lot of blood flows out of a body of human. So macrophages, dendritic cells, cells of all the reticuloendothelial immune cells will come out of the body along with the blood. This can never be compensated until there are stimulations from other infections. So this is a possible option. Now, renin secreted from juxtaglomerular apparatus in hemorrhagic hypertension. This is a possible answer. Next thing. Cardiovascular centers in brainstem become depressed in severe hypotension due to blood loss. This can be cardiovascular centers in brainstem become depressed in several hypotension condition due to blood loss. This can be a possible answer. Considerable quantity of intestinal fluid may be drawn into circulation due to lower hydrostatic pressure in capillaries resulting from blood loss. This is a compensatory mechanism. So intestinal fluid once drawn can be compensated by maintaining osmotic pressure, osmosis. inside body. So this cannot be a possible answer. Peripheral chemoreceptors are stimulated when blood arterial pressure is reduced below 60 mmHg due to blood loss. This is a compensatory thing. This can be compensated if the things are brought back to normal. So this cannot be a possible answer. This cannot be a possible answer. This is a sure shot answer. So we can remove other options. Cardiovascular centers in the brainstem become depressed in several hypotension conditions due to blood loss. See, this is a abnormality condition where the whole individual reacts. This leads to the individual's overall mental consciousness. But if the renin is secreted from the kidney, it doesn't affect the overall mental consciousness of an individual. So, B and C has more prominence of becoming the answer. B is the right option. 12th question, November 2020. Here we have phasic aortic pressure and mean atrial pressure. Various levels of mean atrial pressure are plotted against the changes in the aortic pressure. Baroreceptors are more sensitive to the phasic change of aortic pressure at normal mean atrial pressure. We are asked to find the correct answers. Phasic change in the baroreceptor fiber is less prominent at lower MAP. Baroreceptor firing rate is reduced at lower mean atrial pressure. This is a static thing. Even though the graph is not given, we know the things about baroreceptors. How baroreceptors react and where baroreceptors are located. Baroreceptors are located like it is a hemotactic condition, hemoreceptor where it is present in the aortic arch, and it responds to it gives response if there is very high blood pressure. So the phasic change, the baroreceptor firing rate is reduced at lower mean atrial pressure than normal. B is the right answer. Baroreceptors are more sensitive to the phasic change of aortic pressure at normal mean atrial pressure. Yes, correct. Phasic change of baroreceptor fiber is less prominent at lower MAP. Yes, because baroreceptors are fired when there is a very big change in the blood pressure. Burst of action potential appear in the single baroreceptor fiber during diastole at normal. No, diastole leads to relaxation. So baroreceptors will not be fired. Discharge of baroreceptor even to the extent to systole at higher mean atrial pressure. So discharge of baroreceptor even extend to systole. No. Working of baroreceptor doesn't amount to the formation of systole. Baroreceptor will not lead to systole. So E is not correct answer. D is not correct answer. Phasic change of barofibers is less prominent at lower MAP. See, these baroreceptors are nothing but Receptors that are present in the aortic arch, they are sensitive only to the pressure changes. If the pressure becomes very high, they are fired to reduce the blood pressure to normal mean atrial pressure. This is the basic definition of baroreceptor. So B is the correct answer. That doesn't mean that phasic change of baroreceptor fiber is less prominent at lower mean atrial pressure. Baroreceptors are more sensitive to phasic change of aortic pressure. You can see and interpret from this graph whether A is right or C is right. Normal pressure is 120/80 is the normal pressure. So consider these two things. Approximately, what we can see, baroreceptors are more sensitive to phasic changes of aortic pressure at normal MAP. This is a normal mean atrial pressure where we can see a prominent change. Phasic change in the baroreceptor fiber is less prominent at lower mean atrial pressure. This is a wrong statement. A and B is the right answer. Phasic change in the baroreceptor fiber is less prominent at lower atrial pressure is not correct. Phasic change in the baroreceptor fiber is more prominent at lower mean atrial pressure, because here we have lower mean atrial pressure, here we have higher mean atrial pressure, but the phasic change in the aortic arch is prominent even at low mean atrial pressure, even at the high mean atrial pressure. So according to the graph given, the phasic change in the baroreceptor fiber is not less prominent. Baroreceptors are more sensitive to phasic change of aortic pressure at normal mean atrial pressure according to the graph given, because in the graph corresponds to all the changes in the pressure, but it is very prominent. The change is very prominent. B is the right answer. A and B are the correct options. Next, a question from Icmr JRF 2020. Which of the following drug is used to lower cholesterol? Statins, atorvastatin. Cardiac muscle cannot be tetanized because which of the following reason? Cardiac muscle cannot be tetanized because of long absolute refractory period. Next is a match the following question from December 2019. Vitamin A corresponds to night blindness. Vitamin B12 corresponds to pernicious anemia. Vitamin D corresponds to rickets. And vitamin K corresponds to subdermal hemorrhage. This is the correct match for the question given. Now we are going to see about another question from ECG. We have seen about ECG in our previous video. ECG is recorded by different leads and it is analyzed on the basis of variation of the electric potential at various loci on the surface of body. At the time scale dilation of different waves, after analyzing the ECG, following particulars of heart are proposed. We are going to find the incorrect statement about particulars given. By using ECG, can we know the anatomical orientation of heart? Yes. Various disturbance in the rhythm conduction of cardiac excitation, correct. Extent, location and progress of Ischemic damage to myocardium S. Stroke volume and cardiac output can be detected? No. Volume and pressure changes? No. So A and B is the right answer. Now consider, this is an experiment based question. Consider two cases wherein ventricular end diastolic volume and the cardiac output of the healthy adult individual at rest. This is at rest. This line corresponds to rest. And this line corresponds to exercise. Okay. So, if one does exercise, what will happen? Cardiac output will increase automatically. So, this pink color line represents exercise. We have pink color line in the top here. This cannot be a right answer. This cannot be a right answer. This cannot be a right answer. A is the correct option. Now another question from June 2019. Given below the different intervals duration of electrocardiogram of a human subject to column A in the events of heart during the progress. So we are going to match the options with A. This is a question from ECG topic. So let's try. First, most familiar thing is QRS complex. QRS complex refers to ventricular depolarization. B matches with 3. This is the only point where B matches with 3. So B is the right. Let us check out other options as well. PR interval refers to atrioventricular conduction. QT interval refers to ventricular action potential. And ST interval corresponds to plateau portion of ventricular action potential. So PR corresponds to atrioventricular conduction. QRS complex corresponds to ventricular depolarization. QT interval corresponds to, so for those who don't know, there is P, QRS complex, T and U. So QT interval corresponds to, R corresponds to atrium and Q corresponds to ventricular action potential, and ST corresponds to plateau portion of ventricular action potential. So B is the right answers. Next about marker enzyme. Myocardial infarction. The marker enzyme is creatinine kinase. Pancreatitis. For pancreatitis, it is lipase. Pancreatitis, I will do it with color. Myocardial infarction, creatinine kinase and troponin. Then pancreatitis, lipase and amylase. This is the possible match. Next is about blood plasma protein. Albumin and globulin from a healthy person were separated by electrophoresis. This is a graph of healthy person. Okay. So this is the graph of an healthy person. In a healthy person, we have abrupt increase in albumin, low alpha 2, low beta 2 and a small rise in gamma. This is what our observation in healthy individual. We are going to find what will be the case if the person is deceased, diagnosed with acute inflammatory condition. The condition will be of ulta. There will be decrease in there will not be increase in there will not be increase in albumin. There will be decrease in albumin and there will be increase in alpha 1 and alpha 2. So for this 44th question, A is the right answer. Nothing much to understand. This is purely of interpretation. Even though you don't know anything about blood plasma, you don't know anything about cardiac system, blood components, simply by reading this graph, you can make a short attempt to answer. This is a question from June 2019. Next question from December 2018. Which of the following is not secreted by endothelium? Short. Anybody can answer by seeing the options. That guanosine is not produced by endothelium. Prostacyclin, endothelium, nitric oxide have a relation with endothelium. You might have studied all these things with correlation with endothelium, but guanosine is purely a nucleotide composition which is nowhere related to endothelium, which is not secreted by endothelium. So B is the right answer. Which one of the following amino acids can be used as a diuretic because of its importance in metabolism of ammonia? This is a question that corresponds to urea cycle. The answer is asparagine. Amyloblast. Amyloblast deals with this buccal cavity, teeth. It helps in secreting enamel. It's not related with amalgata, it's brain. It does not secrete amylase. No. So it thinks starts with A. So it doesn't mean that it should have an answer with A. It's nowhere related with the adrenal gland. D is the right answer. Mayo waves. Mayo waves have no relation with this cardiac system, since I included this here, because when you see about this Mayo waves blood related thing, you may think that this Mayo waves are concerned about cardiac system. You may have an answer in the mind that A is the answer. No. Mayo wave are related with reflex oscillation of neuronal pressure control system. This is the Mayo wave. So C is the right answer. Next, this graph is about cardiac cycle. We are going to find what each point signifies. Okay. A is the point where mitral valve or atrioventricular valve actually close. Okay. So Q should corresponds to A. Then B should be the point where aortic valve actually opens. So P corresponds to 2. Next, step by step. C is the point where aortic valve close. S corresponds to 4. Okay. Then atrioventricular valve or mitral valve opens at D. So this is the answer. A is the right answer. This question you answer only if you know this concept. This is the concept of cardiac cycle. A is the point where atrioventricular valve closes. B is the point where aortic valve actually opens. C is the point where the aortic valve closes, and D is the point where atrioventricular valve opens. For the next cycle to be done, only then blood enters into the ventricle. Hope clear. Next question about RBC. Maturation of RBC does not depend on C. While seeing the options randomly, even if you don't know about any vitamins, minerals, components like that, tocopherol has no relation with RBC. It's a different vitamin. Tocopherol is a different vitamin. B is related with pernicious anemia. Folic acid is related with iron. Somehow, pyridoxine deficiencies. There's somewhere you have heard about dementia, dermatitis, diarrhea, and all those things. Tocopherol is an odd one out, so D is the right answer. 57th question, June 2018. Chloride content of red blood cells in the venous blood was found to be higher than that in atrial blood in the human subject. Following proposals were made to explain these observations. We are going to find the incorrect statement. It is nothing but chloride bicarbonate exchange, chloride shift. We have seen about chloride shift in cell biology. If you are good in cell biology, you can easily answer this question even if you don't know anything about cardiac system. So high partial carbon dioxide pressure in the venous plasma leads to increased diffusion of carbon dioxide into RBC and formation of H2CO3. Is this the right answer? Next question. Carbonic acid content in RBC of the venous blood becomes greater than that in plasma. Next question. Excess of carbonic acid leaves the RBC of the venous blood along with Na+. This is a short because in bicarbonate chloride shift there is no role for the sodium. Then increased Na plus in venous plasma is transported to RBC along with chloride. This is a short wrong answer because sodium has no role. Okay. So the right answer is C and D. Simply if you know that sodium has no role in chloride bicarbonate exchange, in chloride shift, you can answer this question. This is a learning for everyone who don't know about this chloride bicarbonate buffer. High partial pressure in the venous plasma leads to increased diffusion of carbon dioxide into RBC and formation of H2CO3. H2CO3 content in RBC of the venous blood becomes much greater than in plasma. This forms the plasma. This induces the blood to come out of, that is HCO3 minus should come out and chloride should get in. This is the concept. If you think, please do comment in the comment section below whether I should do a video on chloride shift in RBC. Please do comment whether you need a video on chloride shift or not. Next, in June 2018, different waves of normal electrocardiogram of human subject are shown below. Relationship of events in the cardiac cycle of these electrocardiogram waves are proposed. P wave occurred due to depolarization of atria. Okay. Atrial repolarization is responsible for T wave. No, it's ventricular repolarization responsible for T wave. B is a short incorrect answer. B can be an possible answer. QRS complex occur due to ventricular deep. This is a correct answer. So this can never be incorrect. We are finding incorrect statement. C is the incorrect statement. So C can't be an answer. Then QT interval indicates a plateau of auricular action potential. No, they indicate a plateau of ventricular action potential. So B and D can be a possible incorrect statement. D is the right answer. Next, June 2017. Most powerful buffer system in blood. So we have seen about the chloride bicarbonate shift just now. Bicarbonate is the right answer. Match the group. Transparent related with binding with iron. Insulin we all know help in the uptake of glucose. Alpha macroglobulin is a proteinase inhibitor. Fibronectin help in the substratum attachment. This is the right match. December 2016. Atrial pressure usually rises and falls to 4 to 6 mmHg in a wave-like manner using respiratory waves. We are going to find incorrect statement. More negative intrathoracic pressure during inspiration reduces the quantity of blood returning to left side of the heart, causing decreased cardiac output. Okay. Respiratory waves are the outcome of oscillation of central nervous system, ischemic blood pressure control. This is not a right answer. This is an irrelevant statement. So D can be a probable answer. Activity of medullary respiratory center can influence vasomotor center. Correct. Changes in the intrathoracic pressure during respiration can excite the vascular and atrial stretch receptor, which can affect heart and blood vessels. Correct. More negative intrathoracic pressure during inspiration reduces the quantity of blood returning to left side of the heart, causing decreased cardiac output. Right. So which is not an inappropriate statement. Is answer is fourth option. That is, the answer is D. So we will deal about inspiration, expiration. So when the pressure inside falls down, what will happen? What will happen if the thoracic pressure inside falls down? Next about baroreceptors. It will respond when there is blood pressure reaches above normal. So hypotension is low, bradycardia is low, venodilation is low, vasoconstriction. Next question. Serum has essentially same composition of plasma except that it lacks anti-hemophilic factor. This is a static portion as in need understanding. Okay. Different leads are used to record ECG in humans. Which one of the following is not a unipolar lead? See, we have three leads. We have seen three leads in ECG. That is limb lead, thoracic chest cavity, that is unipolar. We have seen about three leads so far. That is limb lead, it is bipolar, augmented lead, that is unipolar, and then we have chest lead, that is also a unipolar. So we are asked to find which is not an unipolar. Standard limb leads are bipolar. Augmented leads are unipolar. Chest leads are unipolar. So standard limb leads are not unipolar. They are bipolar. Which one of the following condition does not occur due to stimulation of baroreceptors? That is vasoconstriction. It's a condition that does not occur due to baroreceptors. When the blood pressure is abnormally high, baroreceptor will function to reduce the blood pressure it will bring back the blood pressure to normal. So baroreceptor may have a little mild role in construction. Here we have seen that standard limb leads are, so limb lead are LB. Let's lead the mnemonics. Chest lead unipolar, UV, we have CV, no, we have UB. Augmented leads are unipolar, AU, we have no AI, no, so we have AU. Think of that as mnemonics. Now, limb leads. Standard limb leads are bipolar, LB. Like before, we have no LBW, like before wicket, so think that LB. This question, December 2016. If the blood transfusion of type A donor, incorrect statement, of type A blood donor is given to a recipient having type B, the red blood cells of donor blood could agglutinate, but the recipient RBC could be least affected. Agglutination in recipient plasma causes agglutination by binding with type A agglutinogen. Agglutinin of the donor blood is diluted in the recipient plasma, resulting in low agglutination. Low titer of anti-A agglutinin is cause of low agglutination of recipient RBC. High agglutination of donor RBC is the outcome of high titer of anti-B agglutinin. So what can be the possible? Agglutinin in the recipient plasma causes agglutination by binding with type A agglutinogen. It is not agglutinogen. So A is the right answer. So A is the wrong answer because agglutinins present in the recipient plasma caused agglutination by binding with type A agglutinogen. It will not bind with agglutinogen, first point. Agglutinin present in the recipient plasma causes agglutination with type A agglutinogen. No, it will not bind with type A agglutinogen. It will bind with corresponding antibody. Okay. So A is the wrong answer. Next thing, we have seen the graph just now. Without interpreting, we can answer of mammalian heart. So for mammalian heart, there will not be any flat curve. All the options are wrong. B is the right answer. Now, 107 question, December 2015. Which one of the following is not involved in the pacemaker potential of heart? So pacemaker potential is nothing but the voltage gated potential, which is not involved. H channel, F channel, transient calcium T channel, or long lasting calcium channel. Which of the following is not involved with the pacemaker potential of heart? Is a homework question. Take it as homework. We have already seen in the previous video about T calcium channel, L calcium channel. We have also seen in the past questions about funny channel. So try answering this question. Which of the following is not involved in the pacemaker potential of heart? Whether it is H channel, whether it is a transient calcium channel, or long lasting calcium channel, or F channel. So see whether what is the right answer. Which of the following is not involved with the pacemaker potential of heart? Insulin increases facilitated diffusion of glucose muscle by Translocation of glucose transporter containing endosomes into cell membrane. This is the right answer. Okay. This is bit tricky, very easy, understandable. Glomerular capillaries and true capillaries. It needs pressure, it don't need pressure. It is right, we are asked to find incorrect statement. See, it is stated that the plasma-colloidal osmotic pressures of both the ends of glomerular capillaries and T capillaries are similar. No, they are not similar, they are different. D is the right answer. We are asked to find incorrect statement. So, D is the right answer. S wave. So, we have a complex. As seen, we have a P wave, Q or S complex, T and U. S complex occurs due to late depolarization of ventricular walls moving back towards atrioventricular junction. Next question is about synaptic delay. Synaptic delay is nothing but we consider we have a presynaptic neuron and a postsynaptic neuron. Okay. The nerve impulse has to be stimulated, generated from presynaptic neuron to postsynaptic neuron. The time taken for this delay is fixed time, that is 0.5 millisecond. So B is the right answer. Next about a question from respiratory system, wherein we should know about what is perfusion limit, what is a diffusion limit. Okay, we are asked to find the incorrect statement. Uptake of nitrous oxide and carbon monoxide in the blood of lung alveolar capillary pressure relative to the partial pressure in the transient time of red blood cells in the capillary are shown below. Differences. This thick solid line is nitrous oxide and this is carbon monoxide. Okay. It takes time to reach saturation. It is very well evident that carbon monoxide has very high solubility. The dispersion of NO2 between alveolar glass and the blood is considered as diffusion limited. I have said all the correct statement. Above all these is wrong statement. CO has high solubility in alveolar capillary membrane. It's not that they have high solubility in blood, not in the alveolar capillary membrane. Okay. Dispersion of NO2 between alveolar glass and blood is deferred as diffusion limited. It is not diffusion, it is perfusion limited. Study about diffusion versus perfusion. Okay. We have seen this. That's it. We came to the end of the session. Okay. Hope you learned something new from this video. We have a lot of struggles when dealing with all these questions. Again and again I am saying please go through the previous year questions. Let's now revise all the questions where we had hurdles, tumblings. Concept here is funny channel. Okay. Okay. Then this is static portion. This is bit very simple and logical. Synthesis of fatty acid does not occur in RBCs, right? No, every cell synthesis glutathione. If you know this, if you are from biochemistry faculty, you might have done reduced glutathione test and all those things. D is very incorrect statement. Why RBC does not contain enzyme? RBC do contain enzyme like adenosine deaminase and pyrimidine nucleotidase. C, D is the right, is correct. It's given as incorrect. So C is the right answer. Okay. Compensatory and decompensatory. So C is correct. B is correct. Renin is bit secretory. It's not compensatory. Renin is secretory in nature. Next, this question made us to struggle a lot. You should know about baroreceptor. you should know about how to interpret if a graph is given. Okay. So baroreceptors are more sensitive to phasic change of aortic pressure because the baroreceptors are present in aorta. Firing rate is reduced if it is lower than mean atrial pressure. Okay. Phasic change of baroreceptor fiber is less prominent at lower mean atrial pressure. Okay. Because baroreceptor, it is widely mentioned that it will help in maintaining pressure. They are stimulated when there is high blood pressure. This we have seen. We don't have any problem. No problem. No. Logical. Understandable. This is conceptual. Very, very conceptual graph. You should know this. Understanding. This is very, very understandable. This is ECG. You should know about respiratory waves have nothing to do with central nervous system and this ischemic cardiac heart disease oscillation. It does not occur due to oscillation between some disease and nervous system. No. Now coming again to this baroreceptor topic, which is very, very problematic in today's session. Okay. For baroreceptors are stimulated when there is very high blood pressure. Vasoconstriction will not be stimulated when there is a blood pressure is very high. Vasoconstrictions are done when blood pressure is very, very low. So if the blood pressure is already very, very low and the vasoconstriction stimulation is under progress, then baroreceptor will not be stimulated under that condition. So this is a kind of linking of both the topic of vasoconstriction, vasodilation along with this baroreceptors. This thing have also connect with renin, angiotensin, aldosterone systems. Next is understanding bit that is LB. Augment that is limb lead is bipolar. Augmented unipolar. Then chest is unipolar. I have given you mnemonics as well. Now the serum and plasma, anti-hemophilic factor, so static. This we have seen. That is diffusion coefficient and perfusion coefficient. The solubility of CO2 is not chemically combined with the proteins in the blood to equilibrate rapidly between alveolar glass and blood. This is correct. CO has high solubility. Yes, according to the graph, CO has very high solubility. So A and B cannot be a right answer. CO has high solubility in alveolar capillary membrane. We are not speaking about membrane. Speaking about inside blood, what's happening. CO, carbon monoxide, is not mingling with the membrane. Things that's not carrying out. This can be a possible answers. Okay. This can be a possible answer. Dispersion of N2O between alveolar glass and blood is considered as diffusion method. No, it is not diffusion. It's gradual. And it takes time. And this NO takes time to reach the saturation point. It's not diffusion. In case of the diffusion, the graph will be linear. It's not diffusion, it can possibly be a perfusion. C and D is the right answer. So to answer this question, you should have a good knowledge from cell biology, where we will be studying about diffusion, passive transport, active transport and related graph. So this question you should know things from immunology. So what antibody reacts with what, how agglutination occurs, what is agglutination, first of all, what is agglutination, so one should know about this. Agglutinin in recipient plasma causes this part is partially right. By binding with type A agglutinogen, no, it will not bind with type. It will bind with corresponding antibody. If the recipient is type B, it will bind with antibody of corresponding type B blood. So A is the right answer. So these are wrong because we are speaking about mammalian heart. So B is the right answer. This I want in comment. Earlier I have given homework from this baroreceptor. Now I have clarified completely. Homework question I have done. I have not seen any comments. Now today we are giving with new homework 107 question number Iicsirnet June 2015. What is the answer? H, transient, F or long calcium channel? Let's see who answers. This S wave we have seen. Synaptic delay we have seen. Diffusion, perfusion we have seen. Now band 3. Oh, we have not seen. We have left this band 3. We will better understanding if we study about cell biology. I will be studying about band 3, spectrin, ankyrin protein in the RBC. It is very well established that band 3 protein of red blood cell in the plasma membrane is solely responsible for chloride transport across the membrane. A lysine group in the chloride binding site of the band 3 is crucial for this event. Keeping this in the mind, what is the most appropriate way to load and retain the small anionic fluorescent probe inside the red blood cells of RBC suspended in the phosphate saline buffer? So let's read all the options and can find what can be the possible option by keeping the fluorescent probe inside RBC suspending in the phosphate buffer solution. Incubate RBC with X. All have this option. Okay. We should know whether it is a phosphate buffer or herpes buffer. That is a major challenge here. So we should know what are the two types of buffer that is mentioned in the question, that is phosphate buffer and herpes buffer. So we should read about these two buffers and the nature of these two buffers, and also we read about band 3 protein in RBC. In the next video we will be answering that funny channel question and the question from June 2016, band 3 question. Okay, we have come to the end of the session. Hope you like this session. If you like this session, please do refer this channel to your friends, fellow aspirants. Please do like, share, subscribe, comment this video, and please do share your thoughts about this video, about our efforts to make such a video for Iicsirnet examination. Thank you. Thanks again for watching this video. Thank you.